Hello. Today we're going to talk about 4 skills that you can use to help someone who is having a medical emergency. So the first thing we're going to talk about is stroke. A stroke is damage to the brain due to interruption in blood flow. There's 2 different types of stroke. There's the type that causes a blood clot and it blocks blood flow to the brain, or you can have bleeding into the brain, which will cause stroke symptoms. So some of the symptoms can be broken up into an acronym. There's FAST and then there's BFAST, a little more advanced acronym. So FAST, the F is facial droop. The A is arm weakness, which could also be leg weakness or heaviness. The S is speech difficulty, slurred speech. The T, time to call 911. So facial droop, which looks like your face is kind of uneven on one side. Arm or leg weakness. Speech difficulty, time to call 911. The advanced acronym is BFAST. The B is for balance. If someone has a loss of balance, that could be a stroke symptom. The E is for eyes or vision, visual disturbances. And then FAST, BFAST. So it goes back to facial droop, arm or leg weakness, speech difficulty, time to call 911. FAST and BFAST. The second thing is Narcan. Narcan is a drug used to reverse the signs and symptoms of an overdose. More specifically, an overdose of opioids. Opioids are medications used to relieve pain, like morphine. Narcan can work for recreational opioids or prescription opioids as well. Some of the symptoms for overdose is really slow breathing, almost like a snoring sound when you're breathing. Pinpoint pupils. The person doesn't respond to you. So what you do is you check the person, hey, are you okay? They don't respond, get someone to call 911. And then you can do lay, spray, stay. So lay the person on their back on a hard surface, spray the nasal Narcan into one nostril, and stay with the person. And like I said, call 911. Then we can talk about hands-only CPR. Hands-only CPR. So with this, you would, if you see a person collapse or if someone's unconscious, you check them. Hey, are you okay? They don't respond. You make someone or you tell someone to call 911, but be very specific. Don't just say call 911. You have to say you in the red shirt so that someone knows that that's their job to call 911. All right? Then you take your hand and you place it in the center of the chest and you push hard and fast until help arrives or until the person wakes up. That would be a good outcome. And then for an AED, you can use an AED, which is an automated external defibrillator, in conjunction with CPR. So when you tell the person, hey, you in the red shirt, call 911, you can add on another task and bring the AED, the automated external defibrillator. So you want to use the AED as soon as it's available. Even if you're doing compressions, as soon as the AED is available, you can start to use it. The best way to use the AED is to turn it on first before you start pulling out the pads and trying to place the pads. Turn the AED on first, because after that, it will walk you through the rest of the steps. So turn the AED on and let it walk you through the steps. You're going to place the pads on the person's bare chest. So you do need to expose the chest. There are pictures on the pads to let you know which pad goes where. So if you forget, just look at the pictures. It'll tell you which pad goes where. Something very important about AEDs. When it says analyze, you have to say in a loud voice, clear. And also, before you press the shock button, you say, I'm clear, you're clear, we're all clear. It's very important.